All right, everyone, let's dive into a really critical topic. First aid and emergency care. Now, I know you all have your basic life support certification. You passed the test, you got the card, but what we're talking about today is taking that knowledge from the classroom and knowing, really knowing, how to use it when the pressure is on. So, let's start with the most basic question, right? What even is an emergency? I mean, we throw that word around a lot, but in our line of work, we need a really clear definition because how you answer that question determines every single thing you do next. And here it is. An emergency is any condition that needs immediate medical attention to stop someone from dying or having a permanent disability. Think about that. The stakes couldn't be higher. This isn't about a minor complaint. We are talking about life and death or life-altering situations. It's serious stuff. Now, before we even get into CPR or anything like that, let's talk about your most important responsibility. Honestly, it's being a great detective. You have to know your patients. You see them day in, day out. You know their baseline, what's normal for them. So when something's a little off, you're the first line of defense. Noticing and reporting those small changes can literally stop a full-blown emergency before it even starts. Okay, but what happens when you do find yourself in an emergency? Your heart starts pounding, your mind is racing. It's a stressful moment, no doubt about it. And that is exactly why we have a plan, a simple checklist to fall back on so you can stay focused and do what needs to be done. This right here, this is your roadmap, and you gotta follow it in order. First, you recognize something's wrong. Then you make the decision to act. You check for consciousness, and this is huge. Then you activate help. Get that code team or 911 on the way before you start getting deep into patient care. That way, help is already coming while you're doing what you need to do. So let's really zero in on that third step, checking for responsiveness. This is your first real hands-on assessment of the patient, and what you find here is going to dictate everything that happens next. So let's play this out. You walk into a resident's room. Your gut just screams that something is wrong. You've already done steps 1 and 2. You recognize the emergency, and you've decided to act. Now what? What is the very next thing you do? You have to figure out their level of responsiveness. Are they totally with it? Alert and oriented times 4. They know who they are, where they are, the date, and what's going on. Or maybe they're just kind of confused, disoriented. Or is it worse? Are they totally unresponsive where you can't get anything out of them at all? Okay, so you assess your patient, and they are completely unresponsive. You call out their name, nothing. You give them a firm tap on the shoulder, still nothing. You might even do a little sternal rub. 0 response. This is it. This is the moment the game completely changes. The situation just escalated. Big time. And this, right here, is where your training kicks into high gear. An unresponsive patient, well, that's the trigger. Your BLS algorithm, that whole sequence you practiced over and over, it starts now. So you get down next to their head. You're looking, listening, and feeling for breathing for no more than 10 seconds. You're watching the chest for any sign of movement. You're listening for breath sounds, feeling for air on your cheek. And you get nothing. No breathing. Or maybe just those weird agonal gasps, which, don't count as breathing. At the exact same time, you've got your fingers on their carotid artery checking for a pulse. Again, no more than 10 seconds. And you feel nothing. No pulse. So let's recap. They're unresponsive, not breathing, and have no pulse. Your assessment is done. This is cardiac arrest. And I want you to remember your official job description here. It is to provide appropriate care until the EMS or RRT personnel arrive. You are not just waiting around for the cavalry. You are the cavalry. You're that critical bridge that keeps them going until advanced help can take over. You have to act. This is it. This is the Super Bowl for your BLS skills. It's not a test. It's not a dummy. It's a real person. Everything you learned, every compression you practiced, it was all for this exact moment. So what do? After you've yelled for help, you start high-quality CPR immediately. And what does that mean? It means you're pushing hard and you're pushing fast, right in the center of the chest. We're talking 100 to 120 compressions a minute. Push deep, at least 2 inches, and make sure you let that chest come all the way back up after every single push. You are their heart and lungs right now.
And you do not stop. You keep going with those cycles, 30 compressions to 2 breaths, until that code team gets there and literally puts their hands on the chest to take over for you. After that, your job switches. You have to document everything. What did you see when you walked in? What time did you find them? What time did you start CPR? Every single one of those details is absolutely vital for the team.
So I'll leave you with this. It's one thing to know all these steps in your head. It's a whole other thing to be ready to do them when your adrenaline is pumping and the pressure is on. So take a second right now. Run through this whole scenario in your mind. Because when that moment comes, and it might, your preparation is what will make all the difference. The question is, are you prepared to act?